Right. Hi, I'm Abby Phillips, and I'm going to be going over pulmonary function testing. And this is my first video. All right, so what is a PFT? A pulmonary function test, also known as a PFT, is a group of tests that measure how well the lungs are functioning, assessing various aspects such as lung volume, airflow, and gas exchange. These tests evaluate the amount of air the lungs can hold, how quickly air moves in and out, and the efficiency with which oxygen enters the blood while carbon dioxide is removed. Common types of PFTs include spirometry, which measures the volume of air inhaled and exhaled, and diffusion capacity test, which assess gas transfer from the lungs to the bloodstream. So what patient population and or disease would need a pulmonary function test? Um, so there's many things or um, many different types of populations or diseases that might need it. So asthma patients, PFTs help diagnose asthma by measuring the airflow obstruction and assessing the severity of the condition. The most I have seen like clinical wise, COPD. So patients with COPD undergo PFTs to evaluate lung function, monitor disease progression, and guide treatment decisions. And then interstitial lung diseases, so conditions such as pulmonary fibrosis, can be assessed using PFTs to determine how well the lungs are functioning and to track changes over time. Restrictive lung diseases, so PFTs can identify restrictive patterns in diseases like obesity, hypoventilation syndrome, or neuromuscular disorders that affect breathing. Preoperative assessment. I actually saw this while I was at Centennial. A lot of patients before they went in for their heart surgery were getting PFTs to see how well they would do um, on the vent and how easily they could be extubated. So preoperative pre preoperative assessment. So patients undergo major surgeries, especially those involving the chest or abdomen, may have PFTs to assess their respiratory health and risk of complications. Smokers and former smokers, so individuals with a history of smoking, may be tested to detect early signs of lung damage or chronic lung disease, and then occupational exposure. So, workers who have been exposed to harmful substances may require PFTs to monitor their lung health. Right. So, the four main components that we'll be going over for PFTs. So we have your slow vital capacity. So that is the maximum amount of air a person can exhale slowly after taking a deep breath, reflecting overall lung capacity and function. Then forced vital capacity. So that measures the total volume of air that can be forcibly exhaled after a full inhalation, indicating how well the lungs can expel air. Then forced expiratory volume. So your FEV1 refers to the amount of air expelled in the first second of a forced exhalation, providing insight into airflow obstruction. And finally, your forced expiratory volume / forced vital capacity, so your FEV1 FVC ratio, which compares the FEV1 to the FVC, helping to distinguish between obstructive and restrictive lung diseases. This ratio is crucial for diagnosing conditions like asthma and COPD. Right.